there are two types of murmurs. Now, some patients will know that they have a heart murmur and they can tell you that is an innocent murmur, but most times I prefer to just call the physician and double check, because how you treat an innocent murmur in the dental office is very different than how you treat an abnormal murmur. And it's always a good idea to work in tandem along with the patient's physician when they have a structural or an abnormal murmur. So, heart murmurs may be normal, maybe innocent, or maybe abnormal, may have some significance there. And knowing the difference between the two will determine how we treat the patients. So look at that medical history. If you see heart murmur, ask further, is it an innocent or is it abnormal? And we'll pick up the phone, speak to the physician before we move ahead, because the idea is to make sure that our patients are always well served.